Good day everyone, my name is Marco Sino, and today I'm going to demonstrate how to give the oral medication. So the first thing we do is to look at the medication administration record. I'm going to make it sure that I am on the right patient by looking the name and the date of birth, the medical record number, and any allergy that listed. Then I'm going to look for the meds. So what am I looking for the meds? I'm looking for the name of the medication, the way it's supposed to be given, and in this case this is for mouth. Also check the time that's supposed to be given, and when it due, the amount that's supposed to be given. The first check is I'm looking for the record to make sure that everything is correct. So let's say everything is fine. Now the second check will actually go and pull out the medication. So what I'm going to do, I'm going to compare the medication to what it says on the client record to make sure that everything is matches up. We also need to check the expiration date. Once it expires, obviously we're not gonna give it. So let's say everything is perfect, and that's our second check. The final check thing that we are going to do is I'm going to patient room and I personally give it to the patient. Now I enter the room, knock knock knock, and I'm going to apply the hand sanitizing, and also I provide the privacy of the patient by closing the door, and I'm going to identify the patient with two identifiers, which is her name and also the date of birth. Now that I'm done of all of that, I'm going to have a final check. So once again, I'm going to compare the medication to the patient record to make sure that everything is matches up. Now I'm going to ask the patient if he or she has any allergy reaction of any medication. So if he will say no, then we are all good and we're ready to go. But if he will say yes, I'm allergic to penicillin, then ask him or ask her if what happened if you were given a penicillin, because we have to know the reaction. We have to know it is like a mild reaction or a life-threatening reaction, or are they confusing with a common side effect? Are they confusing with any common side effect? Because sometimes people will say that, oh, I will take that. If I will take that and I haven't ate anything, I get nauseous. Well, that's not an allergy. That is the side effect. So it's better to ask, even if you're not gonna give some medicine, it's better to ask so you could document that for the future. So if you are done all of that, everything has been asked and everything is checked out. So Miss Edna doesn't have any allergy and she is okay. Now we're actually ready to give the med. I have a cup, and here I'm going to put inside a medicine cup. I haven't opened yet because I want her to know if what I'm going to give it to her. Because if you were to open it and then explain it here, there's a chance that they're not going to take it, the medicine, and then the medicine will be wasted. So it's better that you're gonna explain first before you actually open it. So what I have here, if you had a patient that is like a baby or a kid that couldn't get the pill, you eventually have to use the droppers. Or some adult couldn't handle the tablet, you have to use the liquid or a syrup medication. So in this case, my client is fine for this tablet, and this is why I'm going to give it to him or to her. Good morning, Mom. My name is Mark Racino, your student nurse for today. May I know your name and your date of birth, please?
My name is Edna Natevan. I was born on January 15, 1993.
Okay, Mom. Thank you. Can I hold your hand and check your... Thank you. So I am here to give you this medicine, and it's named Promethazine, and you have to eat this based on your record. You have to eat this like once a day for your nausea and vomiting. Is it okay for you to take it right now?
Yes.
Thank you. And Thank you, ma'am, for your cooperation. Do you need something else?
No.
Okay, ma'am, if you need anything else, just call me and I will be right there. Thank you.
Thank you.